Hi there. Thanks for having me on.
I appreciate your time on this and your efforts to tackle HPV. How would you describe our efforts in Ontario so far?
Well, basically, we think that there's a crisis in the school program. You know, the way things are right now, every province and territory has HPV vaccine for boys and girls in the school programs. And Ontario is doing poorly as a province. In pre-pandemic, it was about a 60% uptake, which is not as good as we would like, but okay, it was 60%. Then during the pandemic, it dropped to 5.2% and under 1%. Now, that's because public health was very busy with COVID, which was appropriate, but also because we didn't have in-person schools. And so what we have now is public health trying to catch up. And of course, that's supported by family medicine, by pharmacies, by all allied health professionals who are involved with vaccine. But the numbers are still dismal. The number of young people coming out of high school that are properly fully immunized is about 36%.
Oh, wow. In Ontario or all of Canada?
In Ontario.
Oh,
this
wow.
is Ontario public health data. So it is in Ontario. And we've got the World Health Organization speaking to all countries, suggesting that we need a 90% uptake of vaccine in order by 2030 in order to eliminate cervical cancer as a public health issue. And Canada has a Canadian Partnership Against Cancer that has taken on the mantle of encouraging vaccine and working towards this. And if we've only got 36%, we're far away from that 90% that we need.
What are the largest hurdles for you in these efforts?
You know, I think there's a lot of barriers, and one of the big barriers is that people don't know what they don't know. They don't know necessarily that their children have missed vaccine in the school system. You know, it's generally given in grade 7, but it wasn't given in grade 7 or grade 8 or grade 9 because we didn't have a lot of school. I think there's also barriers of thinking that it may be too late. And we have a big barrier in that pharmacists are able to immunize, but pharmacists don't have access to the public health vaccine. So we don't know who's gone to their family doctor, and lots of people don't have a family doctor. We don't have a registry in Ontario, and I would say that is our biggest barrier is we don't even have good tracking, good numbers for who has been vaccinated, who's been partly vaccinated. Maybe someone got it at their family doctor. Maybe they got it at a walk-in clinic. We don't know that. And so until we're able to track this a little more accurately, we're falling far behind. Alberta, BC, they have a way of tracking vaccine, and we did for COVID. You know, as a family doctor, I got notified if my patient had a COVID shot at one of the COVID clinics. So we do have the ability to do this. We have to decide that we want to do this.
Oh, wow. And our neighbors are doing it, so why shouldn't we, right? If we have the technology and the ability. HPV infection can lead to cancer in so many ways, doctor. For those who don't know,
so HPV is a virus, and, you know, a lot of us will clear that virus. About 75 to 80% of adults have been infected at some point in their life. And most of us clear the virus the way most of us cleared COVID virus. But if you have persistent HPV virus that doesn't get cleared, it does over time lead to different kinds of cancers. And those can be gynecologic cancers, it can be anal cancer, and one of the rising cancers right now in Canada and in North America is head and neck cancers or throat cancers. And so we really want to get people immunized, because what's so exciting about this is that this vaccine is not just preventing infection, it's a vaccine that's preventing cancer. And that's quite incredible. In our lifetime, we've got a vaccine that can prevent cancer. So we need people to take the vaccine. We need people to understand how valuable this is, because the next generation shouldn't have to go to hospital with cervical cancer. And we still have women dying of this every day in Canada.
Can we address some of those barriers that you flagged? Some people think that there's only a certain amount of time to get the HPV immunization. If you're out of high school, is it too late?
Right. So the vaccine was approved in Canada by Health Canada age 9 to 45, but our national guidelines say there's no upper age limit. If you're going to be exposed, you can get vaccinated no matter how old you are. So it's never too late to take the vaccine. And the phrase that we've used in our task force white paper is that there's no wrong door. Wherever you get it is great. We just want to know that you've had it.
Mm-hmm.
I think one of the other barriers is there's been a lot of miscommunication. And so we in the task force have asked that the Ministry of Health and the Ministry of Education and public health units locally, teachers, that we all give the same message so that it's very clear what this is all about. And, you know, in Ontario, we have 34 public health units. Some of them do things really well, and there's some pockets in Ontario that are highly immunized, 70, 80%. And there's other pockets that are not well immunized, that haven't communicated as well to their population.
Yeah. How many shots do you need to be fully protected?
If you're under 14 or under, so that's school-age kids, you get 2 shots. If you're older than 14 when you start, essentially your immune system is not as robust, and so it's a series of 3 shots.
Okay. This is really great information. And I guess we should encourage everyone to just check with their doctor. Hopefully they do have a family doctor. Check their medical records and make sure that they have all the shots.
Absolutely. And if they don't have a family doctor, check with their local public health unit, because public health keeps track of vaccinations for young people up until age 18. As a family doctor, I don't have access to that tracking. That's one of the problems. But public health is keeping track. And so I think if someone can't speak to their own family doctor, doesn't have a family doctor, speak to your public health unit. You know, this is the best insurance we can give our families. This is the best thing that we can do for our children, is we can give them a shot today at age 14, 15 in the school system, paid for by public health, that's going to prevent them absolute morbidity or serious illness and perhaps even death later on in life.
Absolutely. I appreciate this message and your time and all the work that you do, Dr. Brown. Thank you so much.
Thank you for having me. It's a pleasure.
Dr. Vivien Brown is the chair of the HPV Immunization Task Force, chair and co-founder of HPV Prevention Week in Canada, which is this week. It is a great time to check your medical records, check in with your family doctor, whoever monitors your immunizations, and get that up to speed. Cancer cases, the diagnoses are on the rise. More people are getting checked out. I lost a friend who I went to school with to cervical cancer last year, and it was quite painful to see them go through the experience, being diagnosed at stage 4. It just went undetected for so long. HPV immunization could help avoid that.